Hello and welcome to all our viewers from around the world. I'm Kristen Schwarz, licensed midwife and MC here at Gold. And here at Gold, we are getting ready for our Gold Neonatal Online Conference of 2022. And with me here is one of our speakers, Professor Afif EL-Khuffash. Welcome, Afif.
Thank you, Kristen. Pleasure to be here.
Wonderful to have you here. And in a minute, we'll talk about the topic you will be presenting here with us today. But before we do that, can you tell us a little bit, first of all, since it's an international conference, where in the world are you located?
Yeah, so I'm a neonatologist working in the Rotunda Hospital, which is the oldest maternity hospital in the world. That's located in Dublin, Ireland. So the hospital was founded in the 16th century, and it's been providing care for mothers and babies since then.
That's a rich history there since the 16th century. Wow, that's interesting to know. And you have a very interesting background. You mentioned you're a neonatologist, you're a pediatrician, and you are an IBCLC. And this is fascinating and interesting to me. I don't know where it is where you practice, but we don't see that many neonatologists that are also IBCLC. So tell us a little bit about your professional journey and how it all came together for you.
Yeah, I mean, as a neonatologist here, I suppose in Ireland, our role is slightly more expanded than neonatologists that may work in the United States. For example, we care not only for babies that are premature in the neonatal intensive care unit, but we also have responsibility for healthy, well babies that we see on the postnatal ward. And also we have outpatient clinics where we see a lot of babies that come back to us with feeding problems and poor weight gain in the short period after birth. And I felt as a neonatologist that my breastfeeding knowledge was quite deficient, to be honest with you. It's not something that's taught well in med school, and certainly not taught well in postgraduate school in our pediatric training. And I thought that I was doing mothers and babies a disservice by not actually having the proper knowledge to inform them about feeding choices and how to support their breastfeeding journey following birth. So about 5 or 6 years ago, I decided to train as a lactation consultant so that I could improve how I care for mothers and babies. And really, it's have been, I think, a very successful choice for me, because I feel that I can provide much better care to mothers and their babies, not only in the outpatient setting, but also in the neonatal intensive care unit. And as you'll see from my talk, I sort of combined my two passions, which is breastfeeding and also the hemodynamic care, or the care of the preterm's cardiovascular system, together to come up with really some interesting findings in the research that we have done over the last few years.
That's absolutely fascinating, because you mentioned something that we see that here. I am in the United States, and there is definitely education lacking for in medical school, in the medical field, for on breastfeeding and human milk and the properties of human milk. And you probably know better than me, but in the research in the last few years showing the benefits of human milk and what we're still discovering about the properties of human milk is absolutely fascinating. And I feel like it's wonderful that you got that education to better serve your families, because I feel like there needs to be done more to get that knowledge out to also the pediatricians, neonatologists that serve babies and families every day there. So that's wonderful. Now to your topic with regards to your presentation here. It's titled Early Breast Milk Exposure and Later Cardiovascular Health in Premature Infants. So tell us a little bit about it. And you mentioned already, it's interesting, the research you've done and what you found out there. So tell us a little bit what we can expect.
Well, during my talk, I suppose I'm going to first describe the challenges that preterm babies face in terms of their cardiovascular health, not only in the early neonatal period, but also as they grow into children and early adults. We know that preterm infants have, I suppose, maladaptation and poor development of their cardiovascular health that spans up to their early adulthood, and that can have significant clinical effects. And this adverse or maldeveloped state is apparent from the early newborn period. And up until recently, we really could do very little to try and change that pathway. So I'm hoping through my talk, I'll be able to share some of the unique qualities that mother's own milk has into improving cardiovascular health in this preterm population. And I suppose it's a very important topic, especially in the current, I suppose, formula crisis that the United States is experiencing. You know, I think the more we empower mothers and educate mothers to support breastfeeding, something like this can be better prepared for if it happens in the future. And I suppose this crisis has opened our eyes even here in Ireland. You know, we sort of take formula for granted, and that this has demonstrated that it may not always be available in a safe and sustainable way. So supporting breastfeeding now, in my opinion, is more important than ever.
Thank you so much for addressing that. That was actually a question I had next for you about the formula crisis that we're experiencing here in the United States and what kind of impacts you see, you know, it might have in your areas there. So thank you for talking about that there as well.
Yeah, no problem.
Did, you know, we've known for a while now the benefits of human milk. Did anything surprise you that it had such an impact on the cardiovascular health?
Yeah, I was actually surprised about the strength of the relationship between the level of exposure to breast milk and the improvement we see in heart function at a year of age. And what I found quite interesting is that the more exposure a baby had to their mother's own breast milk, the better heart function they had at 2 years of age. So it wasn't a kind of on and off phenomenon. There was a stepwise improvement for each additional week of exposure to mother's own milk, which in my opinion has strengthened the association between the two.
Absolutely fascinating. Can that also be said with, I'm sure in your unit, you're also working with fortified human milk as well. Do you see any differences there with that respect?
So we fortify all of our all of the breast milk in preterm infants. So we don't have a cohort of infants that aren't fortified. We currently use bovine-based fortification. That seems to work well.
Okay, well, thank you so much. Before I let you go, Dr. EL-Khuffash, can you give me a little bit more of what we can look forward to and final last words from you?
So yeah, so I'm hoping for a nice and interactive session. I'm gonna take you through the journey of cardiovascular health in preterm infants, then focus on the unique benefits of breast milk in that context. And I'm really looking forward to a lively and engaging session, and I hope people learn from it.
Thank you so much for sitting down here, spending time here with me and talking about the amazing work you're doing out there in your community and the presentation. Thank you so very much for coming.
You're more than welcome. Thank you.
And now some information for our viewers. This presentation, together with all the other presentations, are of course part of the Gold Neonatal online conference that we have here 2022. We get started with this conference May 31st. This particular presentation will be live on June 7th, but all the presentations are always recorded. So if you can't join us live, there will be a recording waiting for you. So if you would like to find out more, please visit goldneonatal.com. Thank you everyone for listening and watching. Bye-bye everyone.